The United States hitting a significant milestone this weekend with a record of nearly 3 million vaccine doses delivered just on Saturday, now surpassing 100 million total doses administered. But it comes as airports are seeing the highest number of travelers since the pandemic hit, with spring breakers flocking to maskless beaches. Sounds like topless, but maskless. More dangerous, and new lockdowns in Europe as COVID cases surge there. Let's bring into our conversation MSNBC medical contributor Dr. Kavita Patel, fellow at the Brookings Institute, former Obama White House health policy director, someone we turn to make sense of all of this. Just take me through first the significance of 3,000 shots in arms on Saturday, one day.
Yeah, it's so when you have millions of vaccines being given and they're out, yes, it's a lot. That's the good news. When you have that many vaccines being given and there are 38,000 cases in the past 24 hours, we're getting the ratio correct, Nicole, that we're just getting 10 to 1, 10 vaccines for every case, 100 to 1 in this case. And that's incredible. So I do think that we should celebrate when we can. I do also think, though, however, I wouldn't be a good doctor if I didn't remind us that even still with the decrease in cases and the rising number of vaccinations, our cases for the past 24 hours, a 7-day average, are at the level higher than what we saw in August of 2020. So we're getting away, we're getting better, closer to the end of the tunnel, but we're not out of the woods yet, as they like to say.
It seems like now would be the easiest time to convince people to do stuff like wear a mask and just stay home and not take a faraway trip and crowd with other people. But it seems like the opposite is proving to be human nature in this country. People are done. Can you just talk? And it seems stupid. from a science standpoint, what is the importance of getting it right these next sort of 8 to 12 weeks?
Yeah, and I think the key with, I know a lot of people have been kind of concerned that the CDC didn't put out updated travel guidance and people are traveling. Three big things. Number one, it's critical that we do everything possible to not kind of have these variants, which we know are more infectious and more deadly, kind of pose like these outbreaks and hotspot risks. And number two, we know that when people travel, Nicole, they're not traveling just within 100 miles. They're getting on planes, trains, automobiles. They're going to and from areas where case rates of the virus could be going from low to high, high to low, traveling with all these variants. And then the third is that we generally follow trends that we're seeing in Europe. We don't have to, and we're certainly doing more vaccines than part of Europe is. But Europe is experiencing their own surge. We have literally followed Europe 3 to 4 weeks like clockwork. That does not necessarily need to happen. But one thing is true. When we see the B.1.1.7 variant that originated in the UK, when it reaches about 50% of cases, all countries go through an exponential rise. And that's what we want to avoid. So the next 4 to 6 weeks are critical to avoid that scenario. All you have to do is turn on any EU station and you'll see that they're talking about lockdowns again. They're restricting travel, of course, and they're experiencing their own surge. Italy, which we saw those deadly scenes out of at the beginning of the year, Nicole, they're having some of the same flashbacks to previous surges. We need to avoid that.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.